This time, we'll talk about the biological effects of thyroid hormones. Here are the learning objectives. After going through this session, you will be able to describe the biological effects of thyroid hormones, predict the consequences caused by abnormal secretion of thyroid hormones. Let's begin with a case. Miss Lee is 25 years old, and she has recently been diagnosed with Graves' disease, an autoimmune disorder that causes oversecretion of thyroxine. What symptoms and signs can we find in a patient with Graves' disease? You will be able to answer this question after the discussion of the biological effects of thyroid hormones. Thyroid hormone, TH, includes thyroxine, or T4, and triiodothyronine, or T3. T4 is the major hormone secreted by the thyroid follicles. Most T3 is formed at the target tissues by conversion of T4 to T3. The principal difference between them is that T4 has 4 bound iodine atoms and T3 has 3. Thus, T4 and T3. Thyroid hormones affect virtually every cell in the body. Like steroids, TH enters a target cell, binds to the intracellular nuclear receptors, and initiates transcription of mRNA for protein synthesis. Effects of thyroid hormone mainly include increasing basal metabolic rate and body heat production, regulating tissue growth and development, and maintaining blood pressure. Now, let's have a closer look at the specific effects of TH on different organ systems. One of the most significant and pronounced effects of TH is increased oxygen consumption and heat production, augmenting basal metabolic rate and body temperature. TH increases oxygen consumption by inducing the synthesis and activity of sodium-potassium ATPase. While hyperactivity of the thyroid elevates basal metabolic rate and body temperature, hypothyroidism induces opposite effects. A significantly increased amount of TH almost always lowers body weight, whereas weight gain usually accompanies significant hypothyroidism. However, because TH also enhances appetite, which may counterbalance the change in the metabolic rate. Increased metabolism in the tissues causes more rapid utilization of oxygen and the release of greater quantities of metabolic end products from the tissues. These effects cause vasodilation in most body tissues, thus increasing blood flow. TH boosts cardiac output by increasing heart rate and stroke volume due to increased contractility. TH seems to have a direct and rather potent effect on the excitability of the heart, which in turn increases the heart rate. This explains why hypothyroid patients often complain of palpitations. This effect is especially important because rapid heart rate is an important sign. In the elderly, excessive TH can also cause an increased but irregular heart rhythm. However, when TH is markedly elevated, heart muscles weakened because of prolonged excessive protein catabolism. So, some severely thyrotoxic patients eventually die of cardiac failure. The higher metabolic rate increases the utilization of oxygen and the formation of carbon dioxide. These effects activate all the mechanisms that increase the rate and the depth of respiration. And for gastrointestinal tract, TH increases both the rates of secretion of the digestive juices and the motility of the GI tract, producing increased appetite and food intake. Hyperthyroidism, therefore, often results in diarrhea, whereas lack of thyroid hormone can cause constipation. TH is indispensable for growth in children. TH acts synergistically with growth hormone and somatomedins to promote bone formation. In a child with hypothyroidism, bone age is less than chronologic age. TH has multiple effects on the CNS, and the impact is age-dependent. In the perinatal period and infancy, TH is crucial for normal maturation of the CNS and cognitive development. Severe hypothyroidism in infants is called cretinism. The child is mentally retarded and has a short, disproportionately sized body and a thick tongue and neck. Cretinism may result from an absent thyroid gland, a genetic deficiency of thyroid gland functions, or maternal factors such as lack of dietary iodine. Thyroid hormone replacement therapy can prevent cretinism if diagnosed early enough. But developmental and mental retardation are not reversible once they appear. For this reason, screening of newborns for hypothyroidism is mandated. In adults, thyroid insufficiency causes listlessness, slowed movement, somnolence, impaired memory, and decreased mental capacity. Hyperthyroidism, on the other hand, causes hyperexcitability and agitation. A person with hyperthyroidism is likely to be extremely nervous and have many psychoneurotic tendencies, such as anxiety complexes and paranoia. One of the most characteristic signs of hyperthyroidism is muscle tremor. The tremor can be demonstrated easily by placing a sheet of paper on the back of a hand with the fingers straightened to look for fine quivering of the paper. This tremor is believed to be caused by increased reactivity of the neuronal synapses in the areas of the spinal cord that control muscle tone. Please note that although tremor is an important sign, it is not specific to this condition. TH produces difficult sleep because of the excitatory effects of elevated thyroid hormone on the CNS. Conversely, extreme somnolence is characteristic of hypothyroidism, with sleep sometimes lasting 12 to 14 hours a day. Thyroid secretion must be close to normal for sexual functions. In men, low hormone level may cause loss of libido. A great excess of the hormone, however, sometimes leads to impotence. In women, abnormal thyroid function may lead to decreased libido, irregular periods, amenorrhea or menorrhagia. Now, we have the whole picture of the biological effects of thyroid hormone. Can you predict the clinical manifestations of hyperthyroidism? Typical symptoms include elevated metabolic rate, heat intolerance, tremor, sweating, rapid irregular heartbeat, nervousness, poor sleep, diarrhea, and weight loss despite overeating. The eyeballs may protrude if the tissue behind becomes edematous and fibrous. This is the answer for Ms. Lin's story. In summary, thyroid hormone includes thyroxine T4 and triiodothyronine T3, which increases the rate of cellular metabolism. Thyroid hormones increase basal metabolic rate, heat production, oxygen consumption, enhance functions of the cardiovascular, respiratory, and digestive system. Thyroid hormones are obligatory for CNS development and physical growth in infants and children. That's all for today. Next time, we'll discuss the effects of corticosteroid hormones. Thank you.